In the first week, we talk about microlithiasis, where predisposed people to testicular cancer. Second week, we talk about the symptoms of painlessness in the lump in the testicle. Now, we want to do exactly what we will do to somebody who's got testicular cancer. As I mentioned to you, testicular cancer tends to happen in someone between age of 18 to 35. So when that happens, what do we deal with? So after the diagnosis with ultrasound scan and also tumor markers, then the operation can be carried out. The operation can be carried out essentially through one way, not through the scrotum, but through the inguinal area. The inguinal is in the groin area that we can actually take the whole testicle out plus the spermatic ducts, and that is a condition called radical orchidectomy. When the testicle itself just removed from the scrotum, it's actually simply called orchidectomy. When the whole lump of testicle being taken out together with its spermatic cord, then we want to make sure that all the serving lymph node systems are also removed, because by doing that, we can make sure that the whole testicle is eradicated. So the operation itself is quite simple. It's through the inguinal area, and after the operation, patients tend to have a resting period for about 1 or 2 weeks in order to recover from this operation. Prior to doing this operation, we tend to do a CT staging scan to make sure that there is no other area that's involved. If there is, after the removal, the patient might require chemotherapy or radiotherapy. And also, we want to make sure that patient has got enough sperms, because the other testicle might not be so healthy. So before removal of the testicle, sperm cryopreservation might be necessary. So after the procedure, after recovery, only then we will work out whether this is germ cell tumor or non-germ cell tumor, and then from there, further treatment might be necessary, such as chemotherapy and radiotherapy. And remember, the cure rate can be as high as 97%, even though it spreads elsewhere. For the following week, we want to explore something called testicular prostheses. Yes, after the removal of a testicle, we can put a fake testicle inside. So under what other circumstance, apart from cancer, that we put a fake testicle inside? Then stay tuned for next week's Putting Dr. G on the Spot.